for the Technological University of Shannon for let us organizing this midterm event of the Click2move project. And thanks for the leaders of this organization, Alan and Karen. Okay, so I'm gonna give you an overview of the Click2move project, and my colleagues here will explain in more detail the different phases of this project. But just to start, Kieran already explained the consortium, but I wanted to say that this is a European partnership with the Technological University of the Shannon, the National Institute of Public Health and the Environment, and with Karin Proper, the Physical Activity Promotion Agency in Slovenia, and the European Network of Workplace Health Promotion with the representation of Steve, which is settled in Italy, and the University of Vic, as that we are the coordinators of this project. Okay, so I'm not gonna go again with all this discussion and background that already Professor Karin Proper explained really well, but just briefly, we have now more higher levels of sedentary behavior because of the COVID-19. So the home office work is not something new, but that increased dramatically since the COVID. Yeah? So the chance of working from home since that episode. And that also was the reason, as we could see before, this has been the reason of an exponential increase of sitting while we are working from home, which is translated with not only health-related outcomes, but also work-related outcomes, such as presenteeism, reduction, higher levels of presenteeism, also less job satisfaction and work engagement. So the Click2move project has the ultimate aim of supporting active and healthy workplaces in Europe for home office workers, contributing to the well-being and health-related productivity of work. So this project has been divided in four phases, starting with an exploratory phase, in which we had been asking to stakeholders, but also end users, for what is needed to reduce sitting time from this home office context. And the reason is because we did also a systematic review of the literature, but we also make an intense search related to the workplace health enhancing physical activity for reducing sitting time practices. And the fact is that there is no evidence up to date that implement strategies to reduce sitting time to this context. So that's why we start the project with this exploratory phase, with a review and a co-creation phase for creating the Click2move project. Sorry, the Click2move program for home office workers. And we also include, we also work with the stakeholders, to create a training course for the leaders, so to get in touch to the end users, to the home office workers. We are now in this phase here, working in this phase, in the third phase now, implementing and also evaluating the effects of this intervention. And the last, the fourth phase, which is the scalability, is what we are planning now for the last year of the project. So just briefly, In this review of the health-enhancing physical activity practices, as I said, we identified workplace practices that we could find not in the scientific literature, but in real practice. As I said, known practices were documented at the home office context, but we could many things. We can take the knowledge from the office interventions that have been applied before, as many of the mechanisms are similar. So we have a different context. We have a more dynamic context at home, but we have many similar tasks and mechanisms. My colleague here, Iris Perez, will explain to you this, the systematic review, which was our first research study that we did on this project related to the analyzing the effectiveness of digital-based interventions to reduce and break sitting time among home office workers. And you can see between the brackets, because there was not evidence on home office workers, so we focus on this office context. This was, as I said, with the lack of literature, with the lack of evidence, we had to make a step backwards to see in a more perspective way what is needed, what we have to take into account to implement an intervention for these specific settings and context. So we did a qualitative examination of potential barriers and facilitators at home office based for home office based interventions to reduce the centrism from the perspective of employers and employees. So those that it really has to do that change. So my colleague, also Alan Coffey, will explain to you in more detail in some minutes. So putting all this information, all this knowledge together, we could meet international experts on physical activity and occupational health to say, okay, so we have all this knowledge, what we can do, how we can put all this together and create a program from all of this with all of this information. So the aim of this expert consensus was to see what is being done on the office context, what is needed from the perspective of the end users, so the home office workers and those that has to lead those programs, and what has to be, what is next. So how can we build this intervention, the Click2move program, based on all this information? And we asked them for the transferability of those office work strategies, and also the use or the potential use of digital elements to get the potential users involved in physical activity promotion intervention to reduce sedentary behaviors from home. So that is what we get at the end of all this co-creation phase, the Click2move program, which is a digital multi-component intervention to reduce and break the prolonged periods of sitting time from home in order to reduce those behaviors and consequently also increase the job satisfaction, reduce the perception of fatigue, presenteeism, absenteeism, and musculoskeletal disorder, as Karin explained before, which were mechanisms related to those behaviors, these sedentary behaviors. I'm going to explain to you also later on all the elements of this intervention, but just my last slide here for this talk is, okay, so what is next? So we create an intervention, we evaluate that intervention, but how we can really get in touch, how we can engage the home office workers. So what is really important here, and to us, we want to focus next is how we can link to those end users. So that's why we created a training course for promoters, so those that can do something, yeah, to bring those interventions to the real practice. So my colleague here, Steve Bell, will explain to you the training course, how we developed that course, and how it's presented right now. Thank you very much. And I will give the floor to my team colleagues who will give you more detail on it.